And now I have the honor of introducing the man that needs no introduction. Michel Mawad obviously comes from a wonderful pedigree. His father, René Mawad, was the former president of the Lebanese Republic. His mother, Naila, was the first woman elected to the parliament. But just as important, he continues the legacy because he is involved not only in Lebanon but abroad, engaging with the diaspora. He is the executive director of the René Mawad Foundation in Lebanon and the honorary chair of the RMF USA. There's many awards and honors that I can say, but I will just introduce Michel Mawad.
Thank you. Excellency, dear friends of the René Moawad Foundation, before we speak about tonight, let us take a brief moment to remember. Since 2019, and even before, Lebanon has endured what no nation should or even could. A financial collapse that wiped out life savings, a pandemic that pushed a fragile system to the brink, the Beirut port explosion, shattering a capital and the people, and then 2 consecutive, bloody, destructive wars initiated by Hezbollah that have transformed Lebanon into a proxy theater in the regional conflict between Israel and Iran. Once again, unfortunately, the wars of others on our land at our expense. The latest war alone took thousands of lives, injured many more, displaced over 1 million people, and caused tens of billions of dollars in destruction in an economy already on its knees. Today, a ceasefire has been announced. Thank you, Mrs. Ambassador. You make us proud. But let us be honest, it is fragile. And for our economy and for the South, the consequences will take years to heal. Politically, our fight is clear. We need to make sure that this is the last war. We need to end the deadly cycle that has haunted Lebanon since the infamous Cairo Accords of 1969, when we became a battleground for conflicts that are not ours. And this means one thing: a sovereign state that alone decides for war and peace. One army, no militias. And ultimately, peace and structural reforms. We shouldn't forget that. But while politically solutions take time, people cannot wait. And there's another battle, just as critical: to keep the Lebanese rooted in their land, to give them the opportunity that you have proven that once it's given, we know as Lebanese how to succeed. To preserve our social fabric, to reject hatred, especially the dangerous confusion between Hezbollah and the Shia community. To protect what makes Lebanon Lebanon: freedom, diversity, openness, democracy, private initiative, education, modernity, and the middle class that refuses to collapse whatever the difficulties. This cannot be done without you, the diaspora. The diaspora is not a backup, it's a partner in resilience, a partner in defending the Lebanese cause and safeguarding our identity, a partner in rebuilding the country, a partner in shaping Lebanon's future and ensuring our nation stands again. For this, through the Renee Moawad Foundation, we are acting on 3 fronts. First, the first front, the displaced. Over 1 million Lebanese forced from their homes, most with nowhere to return to. Our duty is humanitarian, but it's also national, to support them without allowing pain to turn into division or hatred. At RMF, we are comprehensively supporting 10,000 displaced people across 21 collective shelters. So, to explain, out of the million displaced, there is 125,000 in collective shelters, out of which the Renee Moawad Foundation is comprehensively taking care of 10,000, 8%. We have provided in the last month 38,000 hot meals in partnership with the Norwegian Church Aid, rehabilitated sanitation infrastructure, installed water heating systems, distributed core relief items, and delivered education and psychosocial support. At the same time, we are also supporting families outside shelters through direct cash assistance. All of this in coordination with our government and in partnership with UNICEF, UNHCR, UN OCHA, WFP, and the Lebanese private sector. The second front is the front of those who chose to remain in their homes in the south, despite everything. No need to tell you. Yes, Rima. That includes Jdedet Merjayoun. No need to tell you that these communities are enduring extremely harsh conditions. Most of them have lost their livelihoods, and some of them their lives. But they chose to stay because they know that the moment they leave, they may lose everything and never come back. Supporting them is not just aid, it is protecting Lebanon's land and identity. In the past 10 days, we have activated institutional partnerships in close coordination with municipalities in the targeted areas. With the Norwegian Church Aid, we are, while we speak, delivering 1,000 food boxes to the Rmeish, Dibble, and Ain Ebel region. And this week, we finalized a strategic partnership to serve also the Marjayoun district with Project Hope, a major US NGO operating worldwide, with whom we had already, if you saw in the film, rehabilitated the ICU of Hasbaya Public Hospital in partnership with Latter-day Saints Charities. This is the closest hospital, for those of you who don't know, serving south of Litani villages outside Hezbollah control areas. So those villages, their closest hospital is the Hasbaya Hospital. And starting tonight, we are launching together a live matching campaign. Every dollar you give will be matched dollar for dollar by Project Hope up to $65,000. With these funds, we will not only provide food, but also fuel for electricity, water access, and essential medication. And we are committing, together with Project Hope, to sustain this effort on a recurring basis for the next 12 months at least. The third front is about all the others across Lebanon. Millions of Lebanese, men, women, children, paying the price of a war they did not choose, and in some cases, being used as human shields. Paying the price of that war, and on top of all, paying the price of corruption, economic collapse, lost jobs, unbearable inflation, with no one to turn to, their lives shattered, livelihoods gone. And here, as well, we continue to invest in the Lebanese human being in partnership with institutional donors, renowned international NGOs, and you, the diaspora. 23,000 children supported in education just in 2025. Development projects implemented in the last 10 years with 25% of Lebanon's municipalities. Out of 1,000 municipalities, we have implemented development projects in more than 250 municipalities all across Lebanon. Strengthening local infrastructure and local economies. A full agriculture value chain approach from farmer to market. 15,000 farmers supported in 2025. 1,500 SMEs empowered, creating in the last 10 years 10,000 sustainable jobs. All this because RMF is about sustainability, not dependency. And last but not least, in healthcare, specifically thanks to you, the program that you just saw was financed and supported by you, by the diaspora. What was a vision last year has become a reality. Through the last 10 months, we have supported 500 hospitalized underprivileged patients across 12 hospitals, from Hasbaya in the south to Akkar in the north. And this is just the beginning. We have built a model where every dollar you give generates $6 to $7 of impact. Let me explain to you how. Through a unique ecosystem, our NGO partners, Project Hope, MAP International, Muslim Aid, Islamic Relief, Latter-day Saints Charities, the Catholic Medical Mission Board, METAD, and others, provide medicines and medical disposables and even equipments through in-kind donations. So we get the in-kind donations through those NGOs. You, the diaspora, support the fees, the transport, and the logistics. The Ministry of Health in Lebanon exempts us from custom duties. And partner hospitals commit to covering the treatment costs of vulnerable patients for 70% of the value of supplies they receive. This is how your dollar ends up having an impact of $6 to $7 in supporting patients in hospitals and in supporting chronic patients with medicines, $4,000 a month. This is how your dollar multiplies into real, tangible care. Our MedChronic program now supports over 4,000 patients monthly with free chronic medication and medical follow-up. And thanks to Dr. Gerard Moawad and Her Excellency Nada Ahmed Moawad, we have launched a home care pilot bringing medical services directly into patients' homes, a model that is already proven effective and can be scaled. Dear friends, Supporting RMF is not supporting another NGO. It is supporting a vision and a model built on sustainability, transparency, efficiency, and the unique ability to amplify your contribution. The result? In 2025, we implemented a $22 million program providing more than 250,000 services to 90,000 vulnerable Lebanese across the country. We could not have done this without you. And tonight, we need you again. You have already shown extraordinary generosity, supporting our efforts with $450,000. But for us to sustain and expand our healthcare program on the one hand, and to stand by those who have remained resilient in the South, we are still missing $150,000. I know you are already heavily solicited, but Lebanon is at the crossroads, and few opportunities offer this level of impact. So tonight, I ask you, not as donors, but as friends, as partners, as Lebanese, as believers in a country that is still worth fighting for, a country that together we will save and transform. Let us close this gap. Let us turn it into lives saved, families sustained, and communities protected. Dear friends, Lebanon's future will not be decided by politics alone. It will be carried by people like you. And together, we will build the Lebanon we deserve, the Lebanon we have sacrificed so much for, and ensure our people remain rooted in their land, sovereign, free, and dignified. Thank you to each one of you, to every bit of support that we really need in this country. Thank you to the team of the Moawad Foundation, to our president, Adib Assis, to our executive director, Nadia, where is she? Nadia. To our board, and most importantly, to our rising star and guardian angel, Rima Atraji. Thank you, Rima. God bless Lebanon. God bless America. Thank you.